Hair strands are not constantly generated on the scalp. Instead, hair follicles undergo a natural cycle of growth, rest, and shedding. The scientific terms for each of these stages are respectively anagen, catagen, and telogen. The anagen phase can last from 2 to 6 years and is when hair actively grows. During this period, cell divisions in the hair bulb push the hair shaft up and out of the skin. The longer this process lasts, the more extended and thicker the hair can grow. Following the anagen phase, the hair follicle enters the catagen phase, which lasts about 2 weeks. During this stage, the hair follicle shrinks and detaches from the blood supply, causing the hair to stop growing. And then, in the telogen phase, the hair follicle is at rest for about 3 months. At this stage, the hair shaft is anchored only by the hair bulb at the base of the follicle. The hair is then released, and a new hair shaft starts growing in its place, marking the restart of the whole process. Approximately 100 hairs are shed daily in this manner. Hair loss can change the hair cycle dynamics. Androgenetic alopecia is the most common form of baldness. It's also known for its 2 variations, male pattern hair loss or female pattern hair loss. In this condition, the duration of the growth phase decreases with each hair cycle, while the duration of the resting phase stays the same or is extended. This results in a reduction in the anagen-to-telogen ratio. With each cycle becoming increasingly shorter, the length and thickness of the hair shaft diminish. Eventually, the growth stage becomes so brief that the hair does not develop long enough to emerge from the skin surface, resulting in an empty follicle pore. Androgenetic alopecia typically follows a predictable pattern of hair loss, with men experiencing a receding hairline and thinning at the crown of the head, while women often exhibit thinning throughout the scalp, with the hairline remaining intact. The severity of the condition can vary widely, with some experiencing mild hair thinning and others losing all scalp hair. Another common cause of hair loss is Telogen Effluvium, a type of baldness that occurs when there is an abrupt end to the growing process. As a result, the hair follicle prematurely enters the shedding stage, known as the telogen phase, as previously mentioned. This stimulus happens in many follicles at once, which causes a great amount of hair loss in a short period of time. The causes for this condition can vary, but stressful events, hormonal changes, or nutritional deficiencies are some of the most frequent culprits. Because there is a delay between hair follicles entering the telogen phase and hair loss, these triggering factors occur 2 to 3 months before hair shedding. Fortunately, telogen effluvium is a self-limiting condition, meaning it resolves on its own within a few months. However, if the underlying trigger persists, it can evolve into a chronic form, resulting in ongoing hair loss over an extended period. Among the most common causes of chronic telogen effluvium are iron deficiency anemia, thyroid gland disorders, and malnutrition. Therefore, it is crucial to identify and address the root causes to prevent continuous hair loss. Besides androgenetic alopecia and telogen effluvium, hair loss is also triggered by the immune system mistakenly attacking its own hair follicles in an autoimmune condition called alopecia areata. In this type of baldness, hair follicles stop producing hair altogether, causing hair loss in patches. These areas can be completely smooth and hairless or have short, broken hair. In some cases, hair loss can lead to total baldness on the scalp, known as alopecia totalis, or affect the whole body, known as alopecia universalis. In alopecia areata, hair loss can be unpredictable and vary in severity from person to person. Some individuals may experience only a few small patches of hair loss that regrow on their own. However, others may have extensive hair loss that progresses over time. In some cases, hair regrows and then falls out again, leading to a relapsing remitting cycle. Both androgenetic alopecia and alopecia areata are genetic conditions, and for that reason, there is no cure for them. However, certain medications, such as minoxidil and finasteride, can promote hair growth and slow down hair loss. In advanced cases of androgenic alopecia, hair transplant surgery is also a viable option. For alopecia areata, the use of corticosteroids and immunotherapy are common treatments, helping to suppress the immune system's response and stimulate hair regrowth. Give a like if this video was useful to you.